Dr. Ahluwalia.
Good morning.
Good morning to you. All right. Let us begin with pain relief. This is interesting.
Yeah. So we have two different things to talk about pain relief. The first one is this study. You know, we did this huge study at Harvard where we followed doctors and nurses for like 25, 30 years. And we asked them different questions. And one of the questions we asked them was their food intake and try to correlate it with different disease processes. So one of the leading causes of blindness and vision problems in the elderly is age-related macular degeneration.
All right, so we're going with, we just teased this.
Yeah.
The carrots.
One of the great food myths is not a myth.
That's right.
All right, go ahead.
So one of the food myths is not a myth, and I think that when we say eat carrots, again, we don't know cause and effect, but we found out that the people who ate foods that had vibrant colors,
Like orange bell peppers.
exactly, oranges or kale or spinach or any of these things, seem to have less incidence of this macular degeneration. So eat your carrots, eat your kale, eat your spinach, and maybe it'll work for you.
There's a well-known doctor in town who wrote a book called Eat the Colors.
Exactly.
And
So
that's what it is.
I think
Is it too late for us? I mean, is it something you have to start really, really young?
I don't
or-
think so. I think at any point, if you eat these vegetables that have these carotenoids, it comes from carrot, right? That's
Yes.
the
Is
so
it the vitamin A? Is that what they think? Or?
related to it,
Related,
and it seems to go and help with the pigment in the eye.
All right.
Okay.
Getting to the pain part.
Yes.
So a study done in Canada looking at cannabis. So what they were trying to find out was, is it safe or is it not safe? They weren't looking at how well it works for pain, just whether it's safe or not. And they found that there is no higher incidence of serious side effects taking marijuana in people who are sort of understand what to do with the marijuana. Higher incidence of less serious side effects, so drowsiness, dizziness, a little bit of nausea, things like that, but nothing really bad.
Okay.
So I think this is good. You know, we're slowly exploring, trying to figure out, when to use it, how safe is it.
Does that work in pain relief?
for pain relief?
Yes.
Well,
And speaking of pain relief, a lot of the painkillers can be the placebo effect. There's a new study about that.
Fascinating, fascinating. So here's what we found out, and we all knew that Americans are unique, but this is like really unique. So studies that have been done for the last 50 years, what they found out was that all the pain medicines, when they studied them, the comparison was to placebo. And so one group of people took the pain meds, one group of people took the placebo. And what they found is over the last 25 years, the pain sort of scores have been similar for the pain medicines, but the pain scores for the placebo have been much more effective.
Over the years, increasing over the years?
Yes, so the
Wow.
placebo is being more effective.
Why?
So, and it's only in the U.S. It's not in Europe. It's not in Canada. It's only in the U.S. And what they found was that they think there are multiple causes. Yeah. One is that we market direct to consumers, so the expectations are higher. So when they take the sugar pill, they feel like something is going to happen. The second thing is that our trials are much larger. They last longer, and they're very fancy. So you get paperwork to sign. The nurse comes in. She takes your blood. She chats with you. She counsels you. You think something unique is going on. The opioids that are released in the brain are the same with the pain medicine or with the placebo. So maybe our thinking where we're doing this, compare these two, maybe it's that the placebo works. Maybe we can just use that to help with pain relief.
I ask you this question because I like to ask you big questions,
Yes.
like big picture questions.
Yes.
First of all, maybe we're still very early in understanding any of this. Second of all, are we not beginning to understand that the mind is controlling a lot of this? State of mind, immune system is far more powerful than we have understood.
Absolutely, absolutely. There is no question. I think all physicians, in fact, almost everybody believes in the placebo effect, right? Sometimes you do something and you're like, okay, this is what I'm going to do to feel better. And then you realize it wasn't even what you wanted to take. You took something else.
It was just up here, the mindset.
Right, exactly.
Yeah.
Yes.
I was taking birth control and I lost my headache. Yeah.
You guys were talking about something that I find so repulsive right before we went on the air, but it's what you're doing to stay healthy.
No, well, you're overstating a little bit, but how much can we say about this?
Let's keep the name quiet.
Let's say a very well-known septuagenarian, octogenarian, meaning in his 80s, very healthy, very productive, living a full life. You ask this person,
yes,
do you have some advice or some secret?
Yes. So this person in his mid-80s is doing fantastic work. and completely with it. There's no dementia. And so I was at dinner and I said, tell us what you do. And he said, sardines.
Like just a raw sardine?
Every day.
Every day. Sardines.
One
every
or
day.
two?
Boy, you're being very. He just said he eats sardines every day. You want to know how he prepares them?
Well, are you doing it now?
Well, I've always eaten some sardines, but I will tell you, and sometimes you got to do a little of this when you. But I've kicked it up because of you.
My mom has.
Can I put it like in a smoothie in the morning? Wouldn't you love to?
Sardine smoothie?
Start making a sardine.
That's bad for the sardine and bad for the smoothie. All right.
Eat some herbs after. I think.
Have you been eating a few more sardines?
I love sardines, so I do all the time.
Dr. Sonu Ahluwalia over at Cedars,
Always
thank you so
great.
much for being with us.